Regardless if you have back pain or not, I am going to show you the correct and the best ways that you can sleep so you can have a healthy spine and a good night's sleep. I'm going to first show you some great pre-sleep stretches that you can do that will help prepare your body to get to sleep, to relax your nervous system, and then I'll go into the different positions that you should be sleeping in. And after each of them, I will explain the mechanics on the spine so you can understand why. So are you ready? Let's go. There's 3 positions that you can do before you go to sleep that will really get your muscles loose, your ligaments loose, increase blood supply, and get you to relax so you can fall asleep fast. The first thing is so easy. Just bring in your knees to your chest. If this is as far as you can go, it's okay. Just hold it. You should feel a little light stretch in your lower back, just opening up that lower back area, the buttocks, the discs, and just pull it into your chest. And the next thing you can do is just rock yourself slowly, side to side, really easy as you're pulling up, just to increase that blood circulation, to loosen up those muscles. And just do this for about a minute or so. And the second thing we want to do is we want to loosen up the hips, the sacroiliac joint, and the lower back by just taking one leg over the other knee and just lightly pulling it over. As you stretch your whole side of your lower back, hold it there about 30 seconds, and then you reverse. Take the other one, pull it straight over. You'll feel all that nice stretching just to loosen up that lower back. Before you go to bed, you can look the other way and hold it there a good 30 seconds. It will feel real nice as you release those tight muscles. And the third position, yes, legs up on a wall. However you can do it. Let me explain why. When your legs go up, it changes the whole physiology and chemistry of our body. It kicks in our parasympathetic nervous system. That's the system that allows you to rest and digest. You then get increased circulation from the feet coming back to the heart. As everything starts to ease, you can put your arms by your side. Start breathing in through your nose and breathe out of your mouth. And give yourself about 10 of those deep breaths. This will stimulate many of the organs, the intestines, and this is excellent if you have swelling in your ankles or your feet or your muscles feel achy from a day's work. Just being in this position, let everything drain back through our lymphatic system, our venous circulation, and just lay back for about 3 to 5 minutes. And this will help prepare your nervous system for a good night's sleep. And the first position when we sleep is going to be on our side. Preferably, keep the knees slightly bent. This opens up the lower portion of our spine so the nerves can breathe. We want to make sure we keep the spine in line. We don't want our pillow too high or too low, just even, where we look straight ahead. You can keep your arms out in front of you, preferably not under the pillow. That can make your hand and arm go to sleep, which can give you nerve irritation. So make sure your spine's in line. Make sure the height of your pillow is a little higher than what it would be as if you were going to lay on your back or your stomach, which I'll explain after. But you want to keep the knees slightly bent, something between the knees, if all possible, and you'll have a good night's sleep. So my face is over here, the back of my head's here. You can see the right height of the pillow. That we don't want our neck in this position where the pillow's too high. We don't want it too low. You can see the spine equally balanced right across the plane. Then at this point is that you're going to put a pillow between the knees, keeping the knees bent, because when the pelvis goes forward, we can look back in here. This is when the spaces open up where the nerves come out of. So if you have a herniated disc, a bulging disc, arthritis, or problems on that nerve, by bending your pelvic and your knees like this, it's going to open up the space where the nerve comes out of, and you're going to get a lot of relief. And many of you that sleep on your back, here are some very important things you should follow. 1, your pillow. If your pillow is too high up, it's going to flex your neck forward. That can block off your airway. That can cause sleep apnea. It can cause you to snore. Obviously, you're going to get less oxygen into your body. So you want to find the right pillow that's going to support your neck. A lot of times, many of you may like to use just a rolled up towel, supporting it underneath the neck area. Some people love this. They also have cervical pillows. They're designed to stabilize the neck. Obviously, there's a little hump on the pillow. That can be a great asset as well. So when we're on our back, let's look at our body. The most important thing is our hips, our pelvis, and our lower back. Right now, we're in a little bit of a sway back. So when we bend our knees a little bit like this, you can, depending upon what you put underneath, this brings the pelvis into a different position. It takes pressure off those muscles that are contracted on the lower back, as well as our deep abdominal area. And this eases us. This puts us in a very tranquil position for the body with the least amount of stress. Because as we bring our knees up, it kind of flattens our back a little bit, allowing those muscles to relax, as well as our hip flexors, which is our deep muscles from our lower lumbar spine into our hip area. So, in this position, once we're relaxed, this is a great way to fall asleep. You get a lot of equal balance throughout your entire spine on the bed, but it is very important that if you have a bed that's too saggy or too soft, you really should make those changes, because anything too soft is going to take away that stability of your spine. So you can see when we lay on our back, we don't want the pillow too high. If it is, watch what happens. This puts more of a hunching, more of a curve on our neck area, putting irritation on the nerve. A low pillow is good. But what's even better is a cervical pillow, and some people like to use a rolled up towel, as a rolled up towel will help support the bottom of the neck. Remember, we don't want a pillow too high. And if you look down here, when the knees go over the pillow, you'll see more of a flexion in the lower part of the back. That will, again, take irritation off these nerves. So when you lay on your stomach, you have to turn your head one way or the other. Preferably, you might want to work on a habit of turning it in between this position and face down. Maybe being 45 degrees instead of 90 degrees. Something you can work on. And when it comes to your lower back, if you notice that my lower back is swayed, by putting something underneath the lower back area, this can get that lordosis out of that lower back area, which may help your back tremendously. Many of you may want to use another pillow to put it in the upper pelvic area, and this can really give you lots of relief. So when you sleep on your stomach, make sure your pillow is not too high. Otherwise, you extend your neck, you can irritate nerves. Use a low pillow. The problem with sleeping on your stomach is that you have to turn your head to one side or the other. Not the best position to be in, but many times not even using a pillow can be a great asset for you. So, pertaining to the lower back, when you sleep on your stomach, you may have more of a sway in your lower back. Putting a little bit of a padding, maybe a small little pillow or maybe a towel like this, will take that swaying out of your back and bring it back out to ease these muscles. That is something you can explore with as well. And all of us know the importance of getting a good night's sleep. Because without a good night's sleep, our body cannot repair and heal. Please utilize these protocols, and I honestly feel you will see great changes in your life. You'll wake up feeling refreshed, ready to take on the day, and you're going to heal so much better. Please share this video with your friends and family. Leave your comments below, because I expect many. And most important, make it a great day. I'm Dr. Alan Mandell.